Firefighters and EMTs working together to serve West Tennessee's changing population.
Obesity has become a big problem in the area, and first responders have seen an increase in calls because of it. WBBJ 7 Eyewitness News reporter Dan Lamparello shows us how their resources are being tied up.
400 pounds, 500 pounds, 600 pounds.
Shocking weights that West Tennessee EMTs say they encounter on a regular basis, but they can't lift them alone. The same men and women who answer these calls are the muscle behind calls known as manpower assists.
We respond to usually 4 to 5 a week like that. We go out and help them when they have a very large patient. We'll page out the medical responders to go assist in lifting.
Lifting after a patient falls or is unable to physically move on their own or is too heavy for 2 EMTs to lift them onto a gurney.
You have to just get the first responders and EMTs and paramedics around the stretcher to take the weight off of everybody. It's just a lot easier, a lot safer. We try to reduce back injuries that way.
They also have heavy-duty equipment on their side.
We have stretchers that are supposed to have a limit of over close to 1,000 pounds, which we haven't had one of those in quite a while.
This stretcher here can hold upwards of 700 pounds. It also uses hydraulics to help the paramedics out, but it still takes 2 people. According to the CDC, Tennessee's obesity rate currently stands at just under 34% of adults, the 4th highest in the country, which medical professionals say is shocking.
It's going to have a tremendous impact on our healthcare system, and we need to do more to fix the problem here in West Tennessee.
That's why Frank Sesti is committed to encouraging his patients to face this very difficult battle.
The hardest part is just getting to that point and starting the exercise program, finding a dietitian, working with your health care provider.
Obesity isn't just taking a toll on the individual. First responders say it's putting pressure on the community as well.
It does take a toll. Like I said, we're running 5 to 7 of those a week, and it makes a difference. It really does. It ties up our resources.
Resources which Kathy says are already slim because, like Gibson County, many West Tennessee counties rely on volunteers to provide these essential services.
Anytime they make a call, whether it be fire, medical, or rescue, it's costing them money, fuel, time away from their job. The way they get paid is when somebody tells them thank you.
Dan Lamparello, WBBJ 7 Eyewitness News.
Since 2000, Tennessee's obesity rate has increased 14%, which medical professionals say has increased the population risk for diabetes and heart disease.